Pulmonary resuscitation. The goal of CPR is to literally pump the victim's heart because their heart isn't working. Whenever we inhale about 21% oxygen, and when we exhale about 14% oxygen. So we actually do exhale oxygen, and those rescue breaths are important because you're actually giving the victim oxygen. Even though it's not as much, it's still enough to be effective. The goal is to restore oxygenated blood flow to the brain before death occur, and it's just meant as a delay until 911 comes. CPR is very unlikely to actually reset and restart the heart. The brain can survive after about 1 to 2 minutes. Brain damage begins with no oxygen. 4 to 6 minutes, death of brain cells, permanent damage, and after about 10 minutes, permanent brain death, and of course, death. CPR instructions: you want to make sure the victim is safe or the situation is safe. Approach and shout and nudge to see if they respond. If there's no response, you need to call 911. Check, listen, feel, see if they're breathing. You need to ask permission if you're allowed to perform CPR. If they say no, you can't touch them. But if they don't reply, then the consent is implied and you're ready to go. If breathing has stopped or if they're gasping for air, begin CPR, and if possible, use an AED. And an AED is like a lightweight battery-operated device that shocks the heart according to the rhythm of the heart. And the goal is to kind of reset and restore normal rhythm. And the Good Samaritan law offers legal protection for those people who give reasonable assistance for people that are in like serious emergency need. And that means if they get injured or they die and you're trying to help, you can't be held liable and you can't get sued. And this is meant to help people from just like standing there out of fear of like paranoia or being sued for things like that. So like risks of CPR: sore chest, broken ribs, cracked sternum, vomiting, aspiration pneumonia, which is where you're breathing in liquid, or a collapsed lung, which is called pneumothorax. And a collapsed lung is when air escapes the lung and it fills up the cavity space that's supposed to be empty and hollow. And that air puts pressure on the lung itself, meaning that the lung can't expand, which means the lungs aren't going to work as well. And in West Virginia, it says no person, including a person licensed who in good faith renders care, should not be liable. So no person shall be liable for any damages, broken ribs, as a result of an act or omission in care. So that means you don't have to act. If you don't want to, that's fine, and you can't get in trouble. But if you do decide to try to care, then you can't get in trouble if they get injured or they die. So you're safe either way.